we are free at home, nothing to do, let's get pregnant. Or let's do some IVF treatment, because this time we will never ever get. That's a myth. We should never even think in that line. I'm Dr. Partha, and I'm a reproductive endocrinologist, infertility and IVF specialist, and currently working at Orchid Fertility Center at Dubai Healthcare City. Since March, we have been getting a lot of cases, new cases cropping up in the United Arab Emirates and all over the world, of course, and nobody knew what to do, what was the step forward. Now, the thing was to do or not to do. So we as practitioners, we have to fall back on guidelines. And these guidelines are, the best guidelines are from American Society of Reproductive Medicine from US and the European Society from the UK. Now, these guidelines are very clear that do not start until and unless we are very clear about the effects of the coronavirus affecting the pregnancy and the unborn child. So with that note, we stalled our practice the full month of March and April. We did not do any kind of fertility treatment. But yes, we were of course in the clinic attending to the patient's need. We were doing a lot of teleconsultations, online consultations, getting to know the history of patients and what they are like going, because many people want to talk to you. And we spoke to them for 45 minutes, 1 hour over the phone, and attended to the needs. And if we felt that there was a need for the patient or the couple to come in and do some tests or some scans, then we used to call them. It was a quick in and out scan or a lab test, and then they were back home. And then we used to discuss the reports on phone. So that was the scenario for the whole month of April. We were very conservative. We did not do any fresh treatment. Now, towards the end of April, the American Society as well as the European Society revised their guidelines. And they came up to say that, listen, we can define the fertility treatment as an urgent care need, specifically categories for those people who wanted to start in March, Feb, March, but they got cancelled. We can start with those patients. For somebody who is undergoing cancer therapy and their eggs needs to be frozen or the embryos needs to be frozen. So for them, you finish off those cases, and you can go in for something called freeze-all, where we can freeze those embryos. Don't be in a rush to put the embryos back, and give them some time. Maybe after 2-3 months, by June, July, when things are much better, go and replace those embryos back. So we achieve a healthy pregnancy as well as a successful outcome. So yes, so now starting from May onwards, we have started our ovulation induction. We are conducting IVF. We have started doing the procedure. Now, when we have started doing those procedures, as you understand that IVF is not a one-day treatment. It takes 15 to 20 days. So we discuss with our patients, couples, and ask them about the symptoms, if they have interacted with anybody who has got any kind of symptoms, or they have any kind of symptoms themselves, like fever, cough, cold, and so on and so forth. And if all those points are negative, then we are subjecting the couple for nasopharyngeal swab and oropharyngeal swab to test for the COVID-19. And once the report comes negative, with that negative documented report, we start ovulation induction and IVF stimulation and do the cycle and do the egg retrieval and proceed with the game. We have, let's say, couple A, we have started the IVF stimulation and the treatment. And now on the 7th or 8th day of injections, she comes and presents with fever or not feeling so good, cough and cold. And because right now we are in a pandemic situation, the first thing which you have to suspect is that, is she having coronavirus? Is she a carrier, or is she suffering from the same? And we will immediately do the testing, and nowadays the report comes within 24 to 48 hours. So before we embark and continue her egg retrieval process under anesthesia, we will get the report. And if the report is positive, of course, we will be cancelling her whole cycle. And in case, even if the report comes negative and she is symptomatic, still we will go ahead and cancel a cycle, because we don't know, after 1 week or 2 weeks down the lane, she might be positive. So yes, she should not carry the stress of the whole treatment and become positive later on. So if any hints of fever, cough, cold, or any symptoms, both the husband and the wife, then yeah, we can cancel that. And they are well counseled, and they are signing a consent saying that these things can happen, and they are aware of the consequences. Yes. I would like to start by saying that the myth that we are free at home, nothing to do, let's get pregnant, or let's do some IVF treatment because this time we will never ever get. That's a myth. We should never even think in that line, right? But again, having said that, that does not mean that you should not practice planning naturally. You can always get pregnant. In fact, during this whole month of March and April, we did a lot of teleconsultations and guided a lot of couples, and they eventually got pregnant, right? So if the husband and the wife are absolutely healthy and they're following those precautions, then yes, they can safely go ahead and try to get pregnant naturally. Number one. Number two, if the need be that they have to do any kind of ART procedures, mean assisted reproductive technology procedures like intrauterine insemination or in vitro fertilization procedures, then we do discuss with them the steps which I just mentioned, that you have to be asymptomatic, you need to be doing this test, you need to understand that today nobody knows the effect of the coronavirus on the pregnancy health as well as the unborn child. Also, we have to understand when we go back February, March, a lot of ladies in Wuhan in China, the pregnant ladies, they did deliver, and all those were successful outcomes in the sense that mothers were not affected much, or the ladies who were affected, they did not transmit the virus to the baby, and all the babies till date are good. Nobody has suffered any kind of consequences or negative ill effects on the health after the delivery of the after the baby's delivery. So coming back to the point that do I need to do the IVF treatment or fertility treatment? Yes. If you follow these points as we have suggested, yes, you can. If you're in that bracket that you have been waiting for a long time to get pregnant, you had started this process and we could not complete in February, March, then yes, you can start off with this process, and it is safe to do it as of now. No, all over the world, the American Society, European Society has not reported any untoward incident of this COVID-19 effect on the pregnancy and the child. So it is a case-to-case, individual-to-individual talk and counseling session that we are holding, either face-to-face or through teleconsultation. And once the patients are very, very assured that everything is fine, then only they step in. Again, when they come to the clinic, we are not causing a traffic in the clinic, in the sense that we are restricting our appointments. Like if patient couple A comes in, then by the time she goes, it's the time for the couple B to come. They are not coming together, number one. And if there is a lot of people coming in, then we ask them to wait in the parking lot in their car. Once we are free in the lobby, then we call them upstairs and then we check them out. So those are the precautions we are taking in the clinic. Safe practices, mask, frequent hand washings, yeah, and not to crowd the option area.